Vitor, it's a pleasure to have you as my guest. Welcome to the J Curve.
Thank you for inviting me. Pleasure to be here.
I want to start with a little bit on you. You're trained as a doctor, but somewhere along the way, you ended up founding a tech-enabled health insurance company. So when you look back on like earlier formative experiences, were there any specific moments or influencers that nudged you towards entrepreneurship?
I remember one story. My father and my mother, they got divorced very early. I was like 2 years old, so I was raised by my mom. And she had a few friends that she would spend time with. And I remember being in one of these friends' house once, and she was a HR person, and she had many magazines on management and HR on her living room. And when I was like tired of watching TV, I would like open these magazines and starting reading about strategy, about hiring people, buying companies, doing M&A. So I think it was like 10, 12 years old and reading those magazines and saying, oh, this is work. And after some point, when you got tired of the same magazines, I would read the book recommendations they had. And they usually were recommending Peter Drucker, Jack Welch, Stephen Covey, or Tom Peters. And I was starting reading these books very early on, and it was funny. 8, 10 years later, when I was actually studying business, people would recommend those books. I say, "Well, I read the book when I was like 14," and I think reading those materials in my teenage years helped me to shape a mentality of management and work and strategy and culture and sales. And so I want to be an engineer because I remember one of those magazines, they said, oh, 50% of the good managers, they're engineers because engineers are analytical, like math oriented. So I said, well, I'm going to do engineering school at university. So I applied to engineering. I passed the test, but I also applied to one university that didn't have engineering, and the top course was medicine because a professor told me the medicine would be better. A friend challenged me they would not pass the test because medical tests were harder. So I said, well, I'm studying a lot, so let's apply for engineering for all the other universities, and this I'm going to apply for medicine. I passed the test for engineering. I registered. And when I was in São Paulo, I came from the countryside. I told my mom, well, we are here anyway. Let's visit the medical school. And during medical school, I said, well, there's surely more women in medical school than engineering, because usually engineering, a lot of men. When you're 17, that's the interesting criteria to choose where you're going to spend time.
Important one.
Important one. And also, there was a funny story. I'm a Christian, I'm a religious person, I'm a Christian. I was in church on Sunday, and I was in the waiting list of the medical university. And someone called, I was in the church, I left the church and picked up the call, and someone said, oh, we are calling from the university. We're going to check if your name is called in the waiting list. Are you going to register for the course? I said, no, I don't think so, because I already registered for the engineering. I want engineering anyway. So thanks for that. But who was calling like on Sunday night? Well, it's much harder to pass the test for medical school than engineering. I was like 17. I could try engineering again next year. So we prayed, talked to my mom and talked to my family and church leader and etc. At some point, I said, well, I'm not in the list anyway. I'm in the waiting list for the medical school. If they call me, I'm going to try. I was like number 106. They call up 110. So I said, well, now I'm going to do medicine.
You spent some time at Rock Health in San Francisco during a pretty interesting period of US healthcare. So it was Obamacare, there was digital care, there are all of these new models of care delivery. So how did that time in San Francisco and in Silicon Valley shape your thinking, and what stayed with you when you came back to Brazil?
So in my last year of medical school, we had an opportunity to do 1 month internships, whatever you would pick. So people would do gynecology at USP, people would do dermatology at Johns Hopkins, people would pick a specialty and spend a month somewhere, usually to decide their medical residency. And I said, I don't want to do a month in gynecology and Johns Hopkins. I mean, I don't see any value in that. I really want to build the businesses. So I sent an email to Rock Health and said, do you guys want to work, intern working for free for a month there? And Hallie, the CEO at the time, said, well, we'd love to have an intern working for free for a month here.
It's a great value proposition.
Yeah. And it was interesting time, as you said, for a few reasons. One, Obamacare. Obama at the time, I think he spent $36 billion giving money to providers to use EMRs. And that pushed I think, the first digital health boom in the US. And Rock Health was in the middle of that because Hallie was Harvard MBA. She had worked at Apple before. She was one of the people responsible for approving the health apps in the Apple Store. And she tells that she saw all the digital health apps growing a lot at Apple Store. At the time, it was probably maybe 40,000 health apps. Now they're probably 40 million, but at the time, like 40,000 health apps. And so there's something happening here. I mean, people are really using this new thing called app for healthcare. And who is going to support that? So she tried to build the Y Combinator for healthcare, and that became Rock Health. So also, her husband was the founder of Cloudera, which is like a big data company. So there was an article from Fast Company called him the data god at the time, like because he was really like one of the first data companies. And so she was very well connected in the space, had the Harvard badge. I want to build a Y Combinator for healthcare, and Obamacare was making the Silicon Valley look at healthcare. There was an interesting also because this specific month was demo day. And usually demo day was when all the companies are presenting their results, their outcomes, raising capital. I was an intern giving badges at the entrance of demo day and meeting all the VCs that were investing in healthcare in 2012, 13 years ago. And it was awesome. I visit Endeavor office. Endeavor Catalyst was starting. I remember visiting Alan Taylor in a very small, like WeWork like model, and he was alone in SF starting Endeavor Catalyst. So it was very special month there. And when I was back in Brazil, I said, well, I have to build something here.
What was your intrinsic motivation to come back to Brazil and build it in Brazil, as opposed to, I don't know, set the roots in the US and build something in the US, which at that point was much easier because all the tailwinds were there?
That's like a sideline. But as I was doing events during medical school, I was all into ecosystem creation, ecosystem building. So to me, the accelerator was like an ecosystem business. So instead of building one company, it would support 40 companies. I remember once I was monitoring constantly 400 health tech startups in Brazil. I would know what is happening. It was who was raising capital. So I said, well, I want to use this and build an ecosystem like platform in Brazil. We're gonna leverage maybe the events and the accelerator, maybe raise a fund and focus on that. So in Brazil was a big opportunity nobody was looking at. Again, it was second market for Facebook, second market for Twitter. All the tech companies at the time were social media companies. Healthcare is huge here as well, like second global market, growing faster than the US because of medical inflation. So I said, less competition, bigger market, ecosystem like model instead of building one thing. And there was already a Rock Health in the Bay Area. So maybe why not a Rock Health Brazil?
Talk to me about live healthcare and your experience of turning it around and selling it. And what did that experience teach you?
Yeah. During the second year of medical school, I started what they call in Brazil a junior company. It's a company started inside the university. I was the second junior company in Brazil at the time in the medical field, the first in my university. And we started that. It was a great opportunity to learn more about business, start my first something. And but by year 4, I said, well, this is a junior company for the university. When I leave the university, it's going to stay here. So I have to start my own company. So in the 4th year, I started my own company, started organizing events with professors and speakers, etc. And say, well, let's invite the president of Albert Einstein. Let's invite the president of Amil. Let's invite the president of CEOs of big healthcare companies overall. And they would come because of the name of the university. And after invite the first one, the other one would follow. So I organized 23 events in 3 years. And when I graduated, I gave myself 1 year to see, well, if there's a business here. If there's a business, I stay and continue the business. After 1 year, there's no business, I go back and maybe do some medical residency in neurosurgeon and neurology or whatever it is. So I gave myself that year and eventually it became an event business. We merged to a competitor about 1 year later. I was the CEO for the resulting merger and I led that for 2.5, 3 years. And we sold in 2018 to the largest strategic worldwide, which was a company called Informa Group, 11,000 employees worldwide, 3 billion pounds in revenue, and public trade in London Stock Exchange. And it was a great experience. I think all entrepreneurs, when you want to start a company, you want to be able to do the full cycle. I mean, we start a company initially in my house, then first office, then a merger. Then we need to like do the turnaround of the merger to improve results, then selling to strategic and working during the earn-out period in strategic in a multinational company. I remember when I talked to the first employee they're going to hire, and we agreed on salary. And after we finished, I said, I don't know how to hire her, how to make it formal. And I called Rodrigo Bayer, and I called Rodrigo and said, Rodrigo, I just hired someone, but I don't know how to make it formal. And he said, do you have an accountant? I said, yes. Does she have like a carteira de trabalho? I said, yes. So get her carteira de trabalho to your accountant. He's gonna solve that. Okay, I learned how to hire the first person, and then the second person. And now we have probably hired 600 people around. But how to do the first thing the first time, I think is important, because now it's not doing a merger or buying or selling a company or hiring people or firing people. There's no mystery around any of this bureaucracy or the emotional attachment to those things. So some people get afraid when they say, "Oh, someone want to buy my company. What do I do?" I mean, or someone asked to be fired. What do I do? Or I have to fire 10 people. What do I do? How do I do it? So all those things are not a mystery anymore. I mean, when you started raising capital at Sami, it was the same thing. How to work with a venture capital funds. I mean, what is the governance around it? When someone asked me, it's a priced round or it's an equity round, I said, well, what is the priced round? What is equity round? What is a convertible? And all those tools, when you do that the first time, it became your toolkit for the future. So helps a lot. Sometimes people say, oh, I want to do this and that, but I don't know how. Well, I have 10 options. I mean, just pick one. And that's the difference between those options and the trade-offs, etc. So I think this toolkit is very important.
You also make a lot of mistakes, right? So
Yeah.
you learn on the smaller scale, but at a lower cost, I want to say, than if you were to learn all of that at like properly VC-backed companies. So what were some of the earlier like learnings on the mistake side that you really, really transferred into Sami and you are not repeating those?
There are a few things that I learned from the healthcare market and from my first business that applied very well to Sami when we picked the thesis. There are usually 3 or 4 things that I say. One, market size. One of the reasons we sold the business, the event business, is because it had high margins, but the market was small. I mean, it would be very hard to do an IPO on an event business. I saw Martin Scobari from GA telling about the research they did the other day, looking at the portfolio, trying to understand what is the biggest predictor of success. And they found the market size is the biggest predictor of success. Martin summarized it, and you never outgrow your market. If you define going to be the biggest bakery in Villa Olympia, that's your market. I mean, that's it. So when we look at Sami, we look at the healthcare market and said, this is market size for labs in Brazil. This is market size for pharma. This is market size for hospitals. This is market size for health insurance. So what is the biggest thing you can build in healthcare? A health insurance company. So that's one of the reasons why I picked health insurance. Where at some point at the first company, we pivoted the kind of the ICPs of customers, etc. And when we found a bigger market, say, well, like drinking water from the pipe. I mean, really, it's much easier to make money and sell when there are much more people buying their product, when the market is bigger. Usually when the market is bigger, also you have more people underserved because the big incumbents, there's always a portion of the market they're not serving well. So that's also easier to entry when you have an oligopoly in a big market. So that's one of the lessons. Another thing that we learned is that recurrent revenue is very powerful. First business, we didn't have recurrent revenue. We have to sell these sponsorships every year to the same people over and over and try to find a new story every year to make them renew. Now we have 12,000 contracts paying monthly. And I mean, it's much easier to think about the future when the present and the past are kind of guaranteed because you have like the recurrent revenue. And health insurance was one of the few things in healthcare that was recurrent revenue because labs don't have recurrent revenue. Pharma doesn't have recurrent revenue. Hostels doesn't have recurrent revenue. Again, health insurance, the only of the big buckets that have recurrent revenue. A third thing was I was doing events and monitoring these 400 health tech startups that I saw. And a lot of them were struggling a lot. And one of the things that I learned is that selling innovation is hard. What do? We do AI on the cloud with crypto. Who pays? Nobody pays and everybody pays because in fact it's a marketplace. I mean, this is horrible. We sell health insurance, plain health insurance. I mean, 50 million people buy every year, 150 million other people would love to buy. So when I look at the unicorns in Brazil, Nubank, it's a bank. I mean, Quinton Dyer Loft, a real estate broker that went online. Kavak, car dealer that went online. I mean, you don't have in Brazil and Latin America a company like OpenAI or a Snowflake. You have infrastructure company that went digital because Brazil is a huge market. It needs infrastructure. It needs companies doing like regular businesses. But the digital transformation that happens to those industries supported the creation of unicorns in those space. So I say, well, I don't want to be the crypto AI enabled. No. I want to be health insurance, a digital one, as we call like the new bank of health insurance. But that's it. So there was like a third thing, selling something that people already knew. I don't have to explain to you what is health insurance, why having health insurance is important, just why mine instead of a competitor. It's much easier sale. And a fourth and last thing, the death by pilots. I mean, startups waiting for a pilot at an incumbent, a free pilot for 2 years. And when they finally got some results from the pilot, the incumbent would say, well, the results are okay-ish. We want to pay 10 cents per person per year and want to have 10% of your cap table. I mean, those awkward relationships with big payers and big like enterprise sales for startups. And say, we don't want to be in that position. So we're going to be the payer. We're going to be the mothership and we're going to pay everyone in the value chain, and who pays the piper call the tunes.
Let's zoom out for a moment and we'll talk a little bit about Brazil healthcare markets and health insurance rather markets. For someone outside of the region, how would you describe the dynamics of Brazilian private insurance market when you were starting the company, and especially the contribution of timing in terms of what did you see that made you believe that it was ripe for the invention at that given moment of time?
I think healthcare systems globally, they're very similar. In a way, you have same players in terms of patients, hospitals, physicians, companies paying for their employees' health insurance, brokers. What is also the same is that population is aging. So people are getting older, and getting old becomes more expensive. People want to live longer. One thing in healthcare is that medical costs grow faster than medical inflation, than general inflation everywhere. So CPI, the customer price index, the general inflation would be 1%. Let's say in the US, it used to be 1%. Medical inflation would be 5%. So usually in every country, it's medical inflation is 3 to 5 times general inflation, which means in families' budgets, in companies' budgets, in government budgets, usually healthcare is eating the whole pie. That's why in the US today, healthcare is 20% of GDP or nearly 20% of GDP. And again, growing faster. I was looking at data. I think US grew last year 2.5%. Healthcare grew 7.8%, 3 times as fast as the average economy. So that happens in Brazil. And Brazil is even worse because as any emerging market has higher inflation than developed countries. So when you multiply, let's say Brazil used to be like 4% general inflation, medical inflation would be 20%. So when you multiply 20 times 20 times 20, this compound growth rate for medical inflation really makes the market huge. We are, again, one of the 3 largest private healthcare markets
Can you
worldwide.
put a number of it? Like, how do you think about TAM, for example? You mentioned like in the US, it's like 20% of GDP.
Yeah.
Is
In
it
Brazil, it's
comparable
more
in
like 10 now.
10? Okay.
And that's maybe between 200 to 300 billion now, the whole healthcare market. The private health insurance market last year was like 60 billion. That's the sum of the revenues of the big companies. So when talking about Bradesco, Amil, Flamedica, each of them would make like 5 to 7 billion in revenue in Brazil. You can do $1 billion revenue just in São Paulo City.
Why did you think that the timing was right? Because the healthcare opportunity has always been big, right?
Yeah.
And insurance has always been big. But why was that timing?
We saw technology changing everything except for healthcare. I remember when I met Davi Veles from Nubank the first time when he was a Sequoia yet, in a small office here in Faria Lima. And I remember, oh, I know this guy. I met him at Sequoia, etc. And then he launched a Nubank, and I saw, as everyone saw, like Nubank grow, and said, well, there's something here because he's using technology for that. Why don't we use the same thing for healthcare? And also, as medical inflation was compounding 20% or 20% over 20%, at some point it's going to explode. So It was already 12% of payroll of companies. Now it's probably 14, 15% of payroll of companies. I mean, some companies were paying more in health insurance than payroll itself. It's the second biggest expenditure. And when we started talking to VCs, I said, it's very nice to invest in tech and SaaS, whatever, but all these companies in Faria Lima, their biggest expenditure after payroll, health insurance. So you should take a look at that. So that was part of the pitch as well.
And I know that before actually launching Sami, you and your co-founder, Guilherme, you studied global models for quite some time. So you studied Kaiser, you studied Oscar, which is a very interesting, I think, company built from scratch in the US, to Alan. So what were the patterns that stood out among those companies? And what out of those patterns you took and applied to Brazilian market? And what did you reject as something that is incompatible with Brazil's reality?
A few things stood out. One, primary care, having the family physician, having nurses doing visits, telemedicine, paying physicians differently from the typical fee-for-service model, using at the time was AI, but it was like big data and machine learning to advance clinical studies and support decision making for physicians. So all of that use of technology stood out as well. How to partner with hospitals. So there are a few things regarding distribution as well. There are
What did
many
you learn
lessons.
about distribution?
The distribution is the most overlooked part of building a business. When people are starting a business, usually they want to build the best product. I want to build a product people would love. I want to build the best app. I want to build this cool AI powered, machine learning driven algorithm. Very rarely you see someone say, oh, I want to have awesome distribution. It seems boring, right?
The assumption is they will come if you
Yeah.
build a great product, right? It's a Paul Graham's
Yeah.
theory.
Yeah. And in fact, I mean, for many companies, it's really not the case. I mean, I was listening to a podcast the other day. I think it was the founder of Tinder, founder of, I don't remember a specific company. And he was telling that seasoned entrepreneurs focus on distribution even before the product. One of the reasons this lovable app got so much revenue so fast, like $3 million revenue in 48 hours, because they already had distribution. So they built the app in lovable, but already had distribution. So they made 3 million revenue like in 48 hours. So in distribution, we started selling directly. Everyone was telling, avoid the brokers. Brokers are not easy to work with, etc. But at some point, I said, well, we have to use brokers. And now for over a year, we're working with them. And now they represent already more than 50% of our new sales every month.
Why did you decide in the very beginning to focus on SMBs and kind of independent professionals as opposed to go after the much fatter and much larger mid-market segment?
There are a few
enterprise?
reasons. One, the sales cycles, much longer sales cycles when we talk about enterprise sales. You start talking to a big company now, they might decide in 2 years. That's one thing. Second thing, who would change an incumbent brand for Sami, a new brand, a startup, for a company of 2,000 employees on their health insurance? If someone got a cancer within our employees, is this a startup going to cover that? I'm not sure. So it would be very hard to the HR director to change an incumbent brand to a startup. Nobody fires if you hire IBM.
Yeah.
So it was the same thing. If you buy from an incumbent health insurance, it doesn't work. You say, oh, this incumbents are really bad. Health insurance never works, etc. But if you buy from a startup, it doesn't work. You're fired because you bought from the wrong vendor. So also, this usually require brokers, like global brokers like A or Marsh, etc. You didn't want to use brokers at the beginning. Also because these big companies, they have a lot of negotiating power. So you have very low margins because I have 5,000 employees. I'm going to pay the least price, the smaller price you can offer me. So you have low margins with this. And usually the incumbents are fighting for the big accounts. So it's going to be a bloodshed. I mean, if you're going to fight there with the head-to-head with incumbents right away. So I said, well, nobody is paying attention to the SMBs. They don't have negotiating power, so they pay full price, so high margins. They could accept a local product because you also to offer enterprise customers a good product, you'd have nationwide network. So you need hospitals in all of the major cities in Brazil. There'll be a lot of work to build from scratch. So we said, well, as we're going to offer a regional product, SMBs could buy a regional product. I mean, if you were a restaurant in São Paulo, why do you need networking in Recife? I mean, you don't. So the product would also fit better the SMBs. So underserved, high margins, lower competition, much shorter sales cycle. So they would make a decision in a week or 30 days at best.
What was the understanding of the revenue opportunity from the SMB as a segment if you were to focus on them long term?
Yeah, we started targeting solopreneurs also because by the beginning of year one, we discovered that nobody was selling one life policies for SMBs. So the MACE, the individual entrepreneurs, because the individual entrepreneurs were created in 2010 in Brazil, and but people were unaware if it was unclear from the regulation if an individual entrepreneur would buy an individual product, individual plan, or SMB plan, because they were SMB, they had a business entity, but they're also a single person. So what is the product to offer them, individual plan or SMB? So only in 2018 that the regulator publish a norm saying, well, these guys have a business entity, so they could buy a business product, employer sponsored plan. Or that was the year we started business planning. And when we launched in 2020, early 2021, I said, well, now there's at the time probably 10 million individual entrepreneurs in Brazil that were not offered an option in health insurance. So they would have purchasing power, they would have income, but nobody would sell them a one life policy. So for us, it was a blue ocean, the blue ocean within the blue ocean, because I think we were probably the first to sell one life policies for SMBs, which the regulation was much more friendly. We could cancel the plan, we could reprice the plan. It's very different from individual plans that you cannot cancel, you cannot reprice. Your annual price increase is capped by the regulation. So it was much friendly regulation for a startup. And also nobody was tackling that. Nobody was selling. So we were the first to do that. And it's still the fastest growing segment. It grew 75% over the past 3.5 years in Brazil. So all this future of work thing, like gig economy workers. So it's still a big niche.
Do you have an estimation of how big that revenue opportunity in the segment can be? If you look at the bottom up analysis, for example.
Yeah. For companies below 10 employees, I think, now that would probably be 18% of the pie, which would be 10, $12 billion maybe.
Didn't realize that it's like 18%. That's a substantial percentage.
Yeah, and that's the thing. 10 years ago was 10. Now it's 18. So I think less than 10 years, maybe 5 years ago was 10, now it's 18. So it's growing fast. We see that in culture, in millennials. People don't want to work for IBM for 20 years anymore. I mean, they want to have their own startup, they want to be a freelancer, they want to have their own thing.
You mentioned that there was a number of pivots, and one of the pivots was on this distribution side, like when you decided to focus from going directly to building relationships with brokers. What are some of the other interesting pivotal moments that happened at Sami that impacted the trajectory and the growth that you're experiencing today?
There weren't many. Because we studied the markets so well, we listed our 8 priorities that I call how to win. And I have to say that out of the 8, probably got like 6 right. So
Okay, you now have to state those 8 priorities.
yeah. Okay. I already stated some of them, like primary care, telemedicine, digitization of clinical workflows and non-clinical workflows, personalized medicine, not only focus on curative care, but also preventive care. That's our partnership with WellHub, formerly GymPass. So we were the first to offer GymPass within the product. So it's the company that pays you CrossFit.
That was an interesting bundle, I have to say.
It's so amazing. When we did the partnership with them, I told them I'm happy because we were the first. But on the other hand, I'm sad because we were the first, because it's so clear that people exercising, they're healthier, they use less insurance, but nobody has ever proven that. I mean, every doctor would tell you, well, exercise is going to be healthier. Okay, but how much? Who? When? And for health insurance, how much should I pay for that? So now we see that we have an average for every dollar we spend on GymPass, we have $5 in savings from our members not using the plan as much. So we prove it. The thesis with 2 years of cohorts, 3 years of cohorts, we proved that. We were able because we have your real data on exercise. Typically, what people would do in incumbent practices that they would send you a survey and you would answer, oh, I swear that I go to the gym 3 times a week and I don't drink. I mean, how accurate is that data? And because every time you go to the gym, we check in, we get this data. And also, we pay for all your medical expenses. You do an mammogram, we pay for that. You do MRI, we pay for that. You do a surgery, we pay for that. So we're able to compare your usage of exercise or whatever, and your usage of medical expenses, providers and service, etc. So we're able to cross that. We're now even able to using your PBM data, your discount for medications at the pharmacy. I know that on average, every time one of our customers they go to the drugstore, they spend on average 100 reais, 96 to 106 reais. They buy on average three medications, dipirona, rosuvastatina, and estalopram, the three medications they most frequently buy at the pharmacy. Also, we know the brands of toothpaste, diapers, birth control pills. I mean, I joke, you go to CrossFit on Tuesday, orthopedics doctors on Wednesday, you buy a painkiller in drugstore on Thursday, you probably got hurt on CrossFit. And we know that because we had all your actual data from CrossFit, your data from your orthopedics doctors you went to, and what you bought at pharmacy.
Back to those few pivots that happened. What are the other
Yeah,
interesting
so
learnings?
distribution I think was the biggest. I think we expanded the network a little faster than I expected, really. Why? Because we thought, well, one hostel is enough to take care of 100,000 members. What happens is that people living in the downtown of the city, they don't want to go to the hostel in the south region of the city. So you need to have 5 ERs in the city at least. So we need to expand the network faster than expected. Also, when you go to bigger companies, now we're going up market to bigger and bigger companies. The biggest contract has like 1,500 employees now. There are some people living in the countryside, like nearby cities. So usually the HR person is living in Guarulhos or living in São Bernardo. So we need to expand to nearby cities. We want to stay only in São Paulo, but we now operating 11 cities in nearby. Because you want to sell to bigger companies, you need to have this kind of coverage.
You mentioned going up markets. Going up markets when you start with SMBs is extremely hard. And few companies get it really right. So, what did you learn from that experience of going up market or focusing on the bigger customers, given that you started from this very different segment, still
Perfect.
lucrative, but different segments?
Because we started with companies, always companies, SMBs, but always companies, the systems and the technology for hiring the product, for employees to use, all the tech stack is virtually the same. The difference was in go to market. So, how you approach selling to one person, selling to a company of 1,000 employees. So, that's different. We tested different things, but now we do mostly brokers. And the good thing about brokers is that you enable 1,000 brokers to sell your product, but you only pay them when they actually sell something. So your cost of acquisition is always tied to a sale. That's been the machine for that so far. Usually the conversion rate's lower because a bigger company, they quote with everyone. Every time a big company going to do the renew, they quote with all the insurance and usually stay in the same what they were before. They want to have the price comparison to negotiate with their current health insurer. So conversion rate is low, but as I said, well, conversion rate's low, you have to expand the pipeline. So we're growing the pipeline a lot.
What was the decision to go up market related to? Like, what was the rationale behind that when you think that the opportunity in SMB is like 18% of the
Yeah.
pie?
It started naturally. I remember the first company with 20 employees that came in was the friend of the CTO that had a small software house and said, well, could I buy Sami as well? I said, well, why not? The technology is the same, the offering is the same. So he started. And then came a company like 100 employees saying, well, I want to buy it as well. And then a company 200. So it was most frequently inbound than outbound. At some point, it tested outbound, but it didn't work so much. So the growth was much more inbound. There was no big change, internal change. It's not like a challenge. It's just something that we're not so focused, but it's happening naturally. About a year ago, maybe 5% of our contracts, 8% of our contracts were upmarket contracts. Now like 11%. So it's consistently getting a bigger share of our wallet or our portfolio. But we're not in a hurry to get there, considering the size of the opportunity within SMBs.
Can you define upmarket in the Sami's case?
Yeah, upmarket is anything bigger than 30 employees. Usually they have at least a financial person or an HR person, most frequently a general financial person managing the company. A lot of times the owner. One thing that it helps us to sharpen the funnel is that as we focus on regional products, we sell only regional products, we have to focus on regional companies as well. So going to be a factory, going to be a hospital, going to be companies that don't have so much hybrid working or remote working. So most of their employees are based in São Paulo. So if I have a company like a tech company that have all their employees spread out, I wouldn't have the network to cover that. And based on all the learnings we had, it's very, very, very hard to control loss rate if you try to have a nationwide network. I mean, there's no company that was able to have good loss rate and good margins. Brazil has 5,500 cities. I mean, how can you offer a product is nationwide network that is quality, and you're going to control fraud, you're going to do underwriting correctly, you're going to have volume for those providers to have a good negotiating price there. And so we think, and it's what data has shown us globally, that regional products have much higher margins, or you control the cost much better, also experience, etc.
Let's talk about AI a little bit. I've been talking to many founders, and there's a very measurable impact of AI, especially in insurance space, in financial services space, on anything that touches the client, but also internally on the operations side. So for you in Sami, what is the most measurable impact of AI that you're seeing internally and also externally? Maybe just like give some use cases or maybe like put some
Sure.
label or data in terms of the scale of the impact.
We are working with AI for 2 years now, so it's not a new thing for us. 2 years ago, we partnered with Google, and Google started accelerating our development with Gemini, so we became a kind of a use case for Google. Second year in a row that we go to present the Google Next event in Las Vegas, how Sam is changing healthcare inclusion in Brazil using AI. They launched like Agent Space a month ago, and we are already implementing at Sami, so really have, I would say, special access to those new technologies and a few use cases. We developed, for example, our own ambience listening solution for nurses and physicians. So if you are doing a telemedicine visit, AI is listening to that and generating a clinical summary and filling the EMR with that, the electronic medical records with that clinical summary. So that alone is saving $800 a month from nurses and physicians that don't have to do that. And these professionals can apply their time to taking care of patients, not typing on the computer. Also for prior authorization, for example, if you need a high cost exam that you need to authorize, where you could just take a print of the document and AI will transform that in standards and to do prior authorization for that. Even nurses, when they're discussing clinical cases now, they would upload the cases to Notebook LLM, and it's going to discuss the clinical cases with AI to decide if a patient should stay hospitalized or not, or what should you do next regarding a clinical case. So I think the way we see is that AI is awesome for workflows and to transform workflows. And there are probably very few companies that have more workflows than a full stack health insurance company. There's a quote from Peter Drucker: the hospital is the most complex organization ever devised. And after a few years, so he said, no, I was wrong. The school hospital is the most complex organization ever devised. I think he didn't know insurance. So it's very complex. But again, that's the advantage. I was talking to one VC these days, and that was his point of view as well. He was saying, well, we don't know how much of these AI wrappers will be in the markets as LLMs are becoming more and more powerful. But what we know for sure that a company that's having workflows but is getting the benefits of AI is going to stay there, because I mean, we still have to touch the patient. You still have to do a surgery. I mean, whatever happens in AI and software in the next 10 years, people are still going to need a surgery. But if all this approval underwriting is powered by AI, it's a very defensible strategy for someone in the market, that you have both what is scalable with AI and also what's not scalable, but you own the assets. I mean, you own the relationship with the patient, you own the physicians, the clinics, you underwrite the risk.
What about the fraud and scoring itself? And like, do you see any measurable impact
Yeah.
of AI on in that
After 4
space?
years, we developed a lot of understanding on how to price risk correctly. The loss ratio for the first cohorts were like 85%, which is like loss ratio over premiums. the loss ratio for the second year would be like 69%. Now the cohorts of the third year, like 53%, which is unheard of in healthcare. The fourth year cohorts are getting even better. And that's a mix of adjusting price, underwriting risk correctly, being more efficient with the operation. So what is happening is our gross margin tripled this quarter compared to first quarter last year.
So it's a huge tailwind.
Yeah, for sure.
For-
Especially because I think we're embracing it so much.
It also, the size of the opportunity, I think the early success of companies like Sami, right? Plus the tailwinds represented by technology, it leads to an interesting competitive dynamics on the market. What do you believe is the most durable edge and the most important moats for Sami, or like just in general, how you think about what it takes to win the markets?
I think despite the market size in terms of revenue, revenue doesn't mean margins. So I think it's very important that companies are able to prove margins. And that's why these cohorts are so important. Because especially in a high interest rates market, I mean, you have to be able to pay your bills. I mean, you have to be able to invest in technology. You have to be able to show that you know how to make money, offering people high quality healthcare. So I think the transformation that we've been working on increasing margins, tripling gross profit, is so important. It really becomes sustainable as we prove that people exercising have lower loss ratio than higher margins. We also prove they stay longer in the plan because all other insurers don't offer the same benefits. So the healthy people stay longer with Sami because they say, well, if I'm going to change to an incumbent, but they don't offer CrossFit as Sami does, well, I'm going to stay at Sami. So this becomes a defensible strategy as well.
What about regulations? Do you think about regulations and just the fact that you operate in the heavily regulated environment? Is that a moat? Or how do you think about that?
I think it's a protection at first because it raises the bar for anyone trying to enter the market. If you think all the Series A VCs in the region are already committed to one player or the other, so there's probably no gonna be a new player coming up because it requires a lot of capital to start the business.
On the fundraising side, on the relationships with the investors side, your Series A at the time was one of the largest Series A on the market, and then you raised substantial Series B. What story or maybe investment thesis that you brought to those conversations that resonated so strongly with investors?
I think being a repeatable, successful founder helps a lot when you're raising. I mean, when it was started, I was just had an exit, so I was putting my own money at the pre-seed round, etc. So I think it helps. Knowing the industry, again, it's a complex industry. Being a physician industry that respects so much. Also, pipeline. I learned that there are three things important in building a company: selling, hiring the right people, and if you're in venture backed, raising capital. So these three things are very hard. I mean, selling is always hard. Hiring good people is always hard. Raising capital is always hard. But the good thing about this, you solve all of them the same way. Pipeline. I mean, you want to hire a good CFO, talk to 50. One person going to accept, even by mistake. You want to sell to someone? Well, talk to 50 potential customers. One is going to accept, even by mistake. I mean, you want to raise capital, talk to
100 investors.
100. The last round, we talked to 108 in 90 days. So
You talked to 108
Eight
investors in 90 days.
So that's the pipeline. We have an internal joke now that we don't give up before getting 100 no's. I mean, do we have 100 no's already? No, so keep on. Of course, sometimes you are in a hotter market, you had a hotter pitch, sometimes you know someone already in the fund, you might change the conversion rate based on where you are, who we're talking to, etc. When we raised the capital from Redpoint in the first round, in the seed round, I had been a friend with Rodrigo Bayer for a few years before, since Warehouse. I already knew Manuel was one of the partners. I already knew Anderson from São Paulo Angels, the first angel group in Brazil many years ago. I already knew Romero. I already knew all the partners at Redpoint before. Also, Rodrigo Bayer has been my board member in my previous company, so he saw our struggles, he saw the exit, he participated in everything, so he knew the entrepreneur. All the partners knew me already. Redpoint had invested in a similar company in the US, so they knew the thesis. Rodrigo had worked in a healthcare VC fund in North Carolina before, so he knew the industry. So know the industry, know the thesis, know the entrepreneur. That was like our seed round. For Series A, for example, we had got a no from Mona She's 1 year earlier. They said, "I'm not investing." 1 year later, said, "I'm going to invest." So it was building a relationship until we get there. For Valor Capital, who co-led our Series A, I don't know even if they remember, but I wrote their first healthcare thesis maybe 5 years before that. They had hired me as a consultant at Valor. So it's relationships that you build that might help. But again, 100 every time, or at least 50. I remember once when I got the first no from Monashis at the seed, I arrived home and I had told my wife this odds, like these ratios. And that was probably the 15th no that we got. And I was like sad. Oh no, Monashis just declined. And I was sad. And my wife said, "What is the number?" I said, I'm sorry, what? She said, "No, what is the number? I mean, how many no's you got so far?" I said, "Well, I think this is 15 or so." "You didn't read that book that told you at least 40 is the number?" I said, "Oh, yeah, in fact." So she supported me in that way. I said, because I read there's a book called The VC Game, I think, from Jeff Busgang, I think it is. So it tells like 40 is the minimum, like talk at least 40 VCs if you want to raise capital. We
You
sometimes have to
brought that to
go.
extreme, right?
Yeah, sometimes, I mean, when maybe in 2020, in 2021, when there's more capital available, maybe 40 was enough. Maybe we're talking maybe at even less than 40 to raise our Series A, probably. Now, when capital is more scarce, well, we have to extend the pipeline. I mean, if conversion rates drop it from 3% to 1%, increase the pipeline. It's mathematical. And that's also a learning that I brought from my first company. Because in my first company in the event business, I had a partner who didn't attend high school, but he was very successful. And he taught me that. He said, sales is pipeline. One sale, you're a hero. Congrats. Hitting the quota is pipeline. I mean, there's no magic. Before the end of the month, you can know for sure if you're going to hit the quota or not. Just look at the pipeline. If the conversion rate is 10% and you have 10 contacts and need one, you're going to hit the sales quota. It's mathematical. That's the same for hiring. That's the same for fundraising. That's the same for selling. So when you simplify the math in that way on how to build a business, you solve three of the most important challenges of an entrepreneur.
What did you learn about the founder investor dynamics across this very different market cycles?
I think I'm learning now to see VC as an asset class, in fact, because over time we had being more in touch with LPs as well. So you go further in the value chain and you start to see not only like the VCs as a business to invest in good entrepreneurs, but as a business to give returns to LPs. And that changed a little bit my perspective on, oh, they're not only here to support me, but they're here to give returns to people they promise. And the management fees are good. And they're all, I mean, when you start looking at that, I think you see the industry a little bit different than typical, oh, we're here to support great entrepreneurs and build generational companies. So I think there's that. But I think the biggest lesson I learned working with funds is that you can talk to different entrepreneurs about their experience with the same fund, and the experience will be different depending to who they talk to with the fund. So the partner that sits on your board is probably 90% of the experience you're going to have with the fund. Because usually funds are small companies, maybe 5, 10, 15 people, maybe sometimes 25 people, but funds are very small teams. And you usually interact 90% of the time with the partner on your board, if there's someone who's supporting you. That's going to be the experience. I mean, if it's a partner who doesn't support you, you're going to say, oh, this fund is very bad. I mean, they don't support me. They don't help me. If you have someone that's very supportive, you're going to say, oh, this fund is awesome. So I think that's why it's important to have a good partnership for funds. Something that I've learned, that good funds, they work a lot in their partnerships. I mean, to really have great people in the team, not only to set the example for entrepreneurs, but also to be really supportive and have a team. Because if you don't have a team, are they going to invest in A companies? I mean, are going to support to build A companies? So I think that's probably my biggest lesson. So now when I evaluate a fund, it's less about the brand. Of course, the brand helps a lot, especially some good brand of a VC. They're going to help you raise capital. But day by day, in the daily routine of the company, the partner who sits in your board It's the biggest predictor of success in the relationship.
On that note, we're going to move to the rapid fire.
Okay.
I'm going to ask you 10 short questions, and I'll appreciate your immediate response. The first
Okay.
question is, what's the kindest thing someone has ever done for you in your career?
Forgiving my mistakes. I'm very grateful that sometimes when I hurt someone by something I said, uh, that was working, that someone really forgave me to said, I understand, and that's okay. For me, it was very gracious to get that.
If you weren't running Sami, what problem would you be tackling right now?
It's so obvious to me the opportunity in the market, and I tell people, I mean, if we were not doing Sami today, we would probably be doing Sami, because it's to me being again the payer, the mothership, recurrent revenue, huge, the biggest market, the biggest thing you can build in healthcare, all the workflows you can think of, deploying technology and AI. I mean, it's the hottest place I could be. So uh, wouldn't be doing anything else, I think. Or
What's a popular entrepreneurial advice that you think is completely wrong?
they should be arrogant when fundraising. I've heard that a few times,
Oh.
and it's my personal belief that I don't think you have to be a jerk when fundraising just to create FOMO.
What is the most underrated or under the radar tech company in Latin America today?
Sami, because of the reason described before. I saw Ebanks saying this in the
This
podcast
was just
before.
Ebanks.
I thought it was awesome. Self-serving on my side as well, but
No, it
awesome.
was
You have
Ebanks.
to ignore this question from now on. Otherwise,
You have Ebanks, then you have PicPay. But PicPay, I agreed because like PicPay, they were like flying so under the radar. Like I wouldn't imagine how much money they make, to be
yeah.
quite honest. Okay. What's the next one after Sami? What's the second most underrated or under the radar company?
Second rated company here. I have to think about it.
See, we cannot give up on this question, but we will
Yeah.
change the
Okay, you changed
perspective.
it. I have a one company that I'm a small angel investor there. That's called Salu. They're doing a great job. I mean, they're doing a really great
What are they
job.
doing?
They're doing occupational medicine, which seemed like a boring space in the beginning. But if you think the most active people in Brazil, working in the largest companies in Brazil, have to do their annual exams, it's mandatory by law. And they were able to get a interesting piece of the market, both from incumbents and unicorns, and they did a very good job, growing fast, profitable. Uh, it's one of my investments that I like the most.
If Sami could acquire one company to accelerate growth, what type of company would it be?
That's top secret information. Otherwise, I would review my strategy. But there are a few companies, just to give a polite answer, that could help us grow. Companies that touch SMBs, companies that touch regional companies.
What's a belief you held 5 years ago that you've completely changed your mind on?
That
Not necessarily 5 years ago, but just
that building a venture capital company was the best way or the fastest way to build a company. I think now when capital is more scarce and I see the challenges of building a venture-backed company in this environment and having built a bootstrapped company from zero to exit before, now I would probably do a mix. I would still maybe raise some capital, but I would be more conscious and would use it differently, I think. Not the same way. Of course, we're 2020, 2021, it's easier to raise capital, higher valuations, etc. But still, now that I understand better multiples, understand how we compare to public traded companies, how value creation happens within building a company as fast as we did. Um, I see building businesses in a different way now in terms of also personal wealth.
what's a habit or routine that has had the biggest impact on your leadership and productivity?
Well, I read the Bible every day, and I think that's in terms of leadership and all things. I think it's a great habit. I think in productivity, having kids, it's not a habit. You can have many kids, but okay, so have many kids, but it's not like a habit. But having kids and even get married, it's so different when you arrive home or when you're working from home in a remote setting, and I mean, you want to be with them. I mean, you should be with them, and you really want to be with them. And when I was like single, starting a company, I could work 12, 14, 16 weekends, no problem. I mean, That's the only thing in life give me pleasure or somehow. I mean, all the other activities. Now, um, I mean, it's so good to spend time with my kids. I mean, with my wife. It's so special. So you learn that you have to be more productive, to have time to spend to have this quality time with them. So in the past, I wouldn't be concerned about productivity. Oh, if it's something's taking more time, okay, I can work 16 hours. I don't have to be productive. I just work longer hours. When you have this, I mean, this time they want to spend with them, you have to be more productive.
What's more important, passion or perseverance?
Perseverance for sure.
Why?
Because passion is it's maybe overstated and like name for something they want very much. And I think wanting very much is important, but if you don't have the perseverance, you're not gonna reach it, you're not gonna build it. One thing that I think people don't talk about perseverance when you're an entrepreneur is that you sometimes don't have the option to leave. And sometimes people say, "Wow, you persevere over 10 years in the first company, you're persevering now, etc." I mean, when you raise capital from VCs, promising returns, when you are offering healthcare to 20,000 people, you have 200 employees waiting on you, you don't have the option to, hey guys, I'm going to take a break, take 1 year off and come back. I mean, you don't do that. After you made some commitments, you should persevere.
If you had to bet on one emergent trend shaping healthcare insurance market in Latin America or Brazil, what would it be?
Emerging trend,
Emergent trend.
I think we are pushing the trend of seeing health insurance as a full health benefit and not only a healthcare benefit. As we started offering, as I mentioned, Jim Paswell Hub, uh, discounts for medications. We have a list of other things that we want to do for our members. I remember Nubank. Uh, Banks usually are not something that people like or love. I mean, oh, I love my bank. I mean, it's not something that you hear. But there are some people in Twitter, now X, asking to marry Nubank. I mean, oh, Nubank, I love you so much. Marry me, because people really love the brand and the experience. So I think we want to, in health insurance, we're participating much more in the lives of our members than a bank. I mean, if you're pregnant, we are there. If you are dying, we are there. If you were just born, we are there. I mean, we are paying and participating in all your most important life moments. And people hate insurance. They say, oh, it's the necessary evil. So I think we are pushing this trend that people are going to at some point say, Sami, can you marry me?
Last one. What's a founder trait you believe is underrated but critical for success?
Really caring for people. There's a quote in medicine that says something in this line is that you can be very technical, you can know all the diseases, you can know all the medications, you should know all the treatments and stuff. But when you're caring for someone, be just a person. I think it's so important and still underrated.
Vitor, thank you so much for dedicating time, and it's been a pleasure.
Thank you. It was great. Great pleasure to be here.